A new UNAIDS report has praised global progress in the fight against HIV and AIDS, but is warning that recent funding cuts could undo decades of hard-won gains. The 2025 Global AIDS Update highlights major achievements, but also sounds the alarm. Without urgent global solidarity, millions more could be infected and deaths could increase in the coming years. For more on this, we're joined this afternoon by the director of UNAIDS in Eastern and Southern Africa, Anne Githuku-Shongwe. It's great to talk to you, Anne. Thanks very much indeed for coming on. And this global update was launched just earlier this month, and it showed some really remarkable achievements. Can you tell us about the positives here?
Thank you so much, Michelle, and thanks for the opportunity to revisit this report. Indeed, we launched here in South Africa. And, you know, the report shows that before this year's disruption in terms of financing, we had done exceptionally well. Particularly in Africa, we had made such huge efforts where many countries were already achieving the targets that we set for treatment. In many countries, nearly 95% of people living with HIV were testing, were getting the treatment that they need, were virally suppressed so that they don't infect others. You know, multiple countries, Zimbabwe, Kenya, Botswana, Namibia, these countries, many of them had done exceptionally well. South Africa too, even though, of course, in the case of South Africa, this is a much bigger epidemic than it is in other countries with about 8 million people. So we'd made significant progress. We had seen a drop in AIDS-related deaths by over 50%. We had seen infections going down significantly. And our region really doing exceptionally well in Eastern Southern Africa. But still, we have 21 million people living with HIV, overall 26 million in Africa. And so we're still fragile, even though we've been doing significantly well. And the report was pointing to this. And the report was saying that if we continue as we are going, 2030 is a possibility if we just take on, new tools that are available. But unfortunately, what we've seen is a dramatic disruption in this last year. And this is causing us real concern. Because of the sudden withdrawal. Many of our countries were very highly dependent on these resources. For some countries, Zambia, Tanzania, 80 to 90% of the response to HIV was coming from external resources. So you can imagine when that stopped suddenly with no preparation, it's meant that the consistency of supply of drugs, the ability to access treatment, even things as simple as condoms, which were being supplied through resources that were from external partners, suddenly are unavailable. And so what this means is that we could see an additional 6 million new infections and up to 4 million new AIDS deaths by 2029 if we don't reverse this, if we don't find ways to mitigate the impact of this withdrawal of resources. And I would say 75% of these new infections and new AIDS deaths will likely come from the African continent. So it is hugely impactful for us, and we are concerned about this. And this is what the report was sharing. Yeah,
I mean, it's several steps back, isn't it? Because 2030 was that goal we had in sight. And just given the kinds of numbers UNAIDS has shared with us, a 40% drop in new infections between 2010 and 2024, a 56% drop in AIDS-related deaths between 2010 and 2024 as well. The 2030 goal, Anne, was around ending the AIDS pandemic as a public health threat. That is now in serious danger.
It is in serious danger because we continue to see many of the threats that have always been there. Like I said, the resource issue is a big one because of the way programs were designed. The health systems are supported through a lot of these resources to make sure that communities themselves, people living with HIV, those who are most vulnerable, are at the center of delivering services themselves. And those were cut immediately. So where you had young people, key populations who are people who are really vulnerable, men who have sex with men, sex workers, they were engaged themselves in delivering services to one another. And that made the reach so effective. In fact, the community-centered approach is a big win for the health systems in African countries in terms of the HIV response. So that's been impacted. And so we're very concerned that that has already shown signs of slowing down of access by people who sometimes face stigma and discrimination in hospitals. And so even though countries turned their attention and said, we will make sure everybody has access to treatment, in truth, they're not able to provide the services in the same way that community organizations were doing. I think one of the things that the report talks about is the fact that we have a huge opportunity in front of us, that if we were to really mobilize ourselves towards this, we could catch up and be able to really achieve this target. The first one is that countries are resourcing themselves. They're figuring out how to mobilize their own resources. A country like Tanzania that was at 90% dependency on external funding, in the last month and a half have announced a new levy, a new health levy, that will help contribute towards their HIV response and other health responses. So a lot of these have started emerging where countries are standing up and saying, we are not going to stand and wait, we will take control of the epidemic. That's one. The second thing is that there is a new drug that's on the table, lenacapavir. It is, our executive director calls it a miracle drug, because this is a drug that really shows that if you just have 2 injections a year, you could actually prevent HIV new infections. And there has been investment by the Global Fund to reach 2 million people in Africa starting in this 2025. But the cost of the drug is unreachable for the majority who really need it. And so we are working together on a campaign to really push for the pricing to go down. We're back to that 25 years ago when we were pushing for TAC were pushing and others to make sure that the drugs become accessible. Because right now it's $25,000 per year per person. And so we need those numbers to go down. We need African countries to have access to the intellectual property so that they can also produce those drugs so that they're accessible to everybody. And that can help us really turn around the tide of this epidemic. We are also very concerned about international financial flows, debt, the fact that countries are carrying such heavy debt. And unless this is transformed, unless we really work together, and there was a huge financing conference recently where this was being tackled, these are the barriers that we are faced with. We're also faced with some human rights barriers in many of our African countries where there isn't freedom of access and movement, and there is stigma and discrimination against people living with HIV or some of the populations that are very vulnerable, people who inject drugs, LGBTQI and sex workers as well, and who are very, very vulnerable. Young girls, in our African context, we still have, 3 out of every 3 girls are infected more times than a boy of the same age between 15 and 24, right? 3,000 infections every single week. So we still have some key areas that we have to focus our attention on. Imagine if these girls had access to this lenacapavir. Yeah. If they could get this injectable, then we have prevention for real. So Absolutely. It is a challenge, but there are also opportunities.
Yeah, that's an important point that you raised, that there's this increase in the number of countries criminalizing the people who are most at risk, and you've already mentioned those groups. I mean, healthcare workers, Anne, showed up to their clinics around the world, and here in South Africa as well, on the day with signs up on the wall saying that funding had been cut and the clinics had been closed. If we had at least some kind of forewarning, do you think that the devastating impact of this withdrawal of funds would have been lessened?
Absolutely. Actually, we anticipated that the resources would begin to decline. Naturally, as we were doing better and better, the resources would begin to decline. So a year ago, we began planning for what we call sustainability. And we started working with countries to develop sustainability roadmaps. And they developed them with a plan for how governments would begin to increase their own contribution, how they would begin to take on more and more activities that were being run by others, clinics that were being managed by external partners or NGOs, and how countries could increasingly take this on. So we'd worked on this. We'd already had, up to 25 countries engaged in this work and really actively working, recognizing that over the next 5 years, we will see a reduction in resources. And so we were anticipating it, but never did we imagine that there would be an overnight cut. And so countries were not ready. They were not prepared. And so this has been a real, disruption. It has created a crisis in countries, and where countries have done their best. And I'll just give you one example. We visited a clinic here in Itirileng, in Soweto recently. And in that clinic, what we found was that, the people who are impacted, for example, are data capturers. In one small part of the clinic, there was a men's clinic. And in this men's clinic, there were 2 men who were outreach workers who would go into the community, go into the clinic, and try to bring men to the clinic. Men are not very strong health seekers. And so they would go out and bring men into the clinic. Well, they lost their jobs. Because they lost their jobs, that clinic was seeing initially 200 men every week. They were now down to 50 men only. So you can already see what the direct impact is from losing 1 or 2 workers. And across Africa, we lost over up to about 200,000 health workers because of the resources that we lost. So the impact was just too sudden and really disruptive. But yes, we were anticipating it and had began to plan. And honestly, we were positioned to really enable countries, and countries were already deciding how they were going to change. Some countries had already declared we're going to increase by 10%, Uganda and others, we're going to increase by 10% year on year. We're going to take over X services. We're going to make sure that we're the ones who are delivering we're going to take over the actual drugs, the procurement of ARVs. But suddenly, this disruption in a way that was very, very, very disorganized. If it was one disruption, it was obvious it would have been one thing. But there was a disruption. Then, 2 weeks later, there were change in policy. So some people could run part of the clinic, but not the other part of the clinic. So really a huge disruption and lots of confusion. But I must say that there has been a lot of resilience where clinics are showing that they've made their adjustments. They're trying their best to get back. But it's obviously too little, too late. And we know that we've already lost significant ground in our response.
It's heartbreaking that it will come at the cost of more infections and even more deaths. And Githuku-Shongwe, let me thank you for your time. Incredibly important discussion there. She is the UNAIDS Eastern and Southern Africa Director.